Yo, what is up YouTube? It's your boy Bobby D, and I'm back again with another hot, juicy video. And I'm back again with the hair whisperer himself, Steve Cook here in Austin, Texas, to provide you guys with some more hair-related content. And Steve, I've been getting, I've had friends come up to me and they've been trying the oral minoxidil, and some of them, have gained weight or had, heart issues with that. And so I'm kind of skeptical. Then I'm like, oh man, is that something I should take? I have anxiety as it is, so it's kind of a little bit stresses me out. And so I just kind of ask you, Steve, what do you think about it? And is that something you should consider taking?
Hey, first of all, Bobby, let me say glad to be back, and glad to be back on the channel, and always a pleasure helping out. Everybody out there, thanks for watching. Oral minoxidil, in my world, is one of those like holy grail. Oh my God, this is great. And why is that? Because I lost my hair at 18 years old and there was nothing but maybe a little pills that were minoxidil that used to crush up with some alcohol, which was a nightmare to rub on your head. I still personally believe that Rogaine is hard to use. I've met very few people that could rub a topical of any kind on their scalp, not their hair, but their scalp twice a day. So all that being said, the oral minoxidil makes it a lot easier. So it is a wonder drug. It is a miracle cure, just tad under the finasteride, in my opinion, and this is just my opinion. But the next thing I'm going to say is you need to talk to your doctor if you're hesitant in any way. Make sure you don't have any issues, any health issues. I am not a licensed physician. Bobby's not a licensed physician. This is just all educational and our experience, and we're just happy to help. What I have seen over the years of about seven and a half years of using oral minoxidil is very, very positive. I've seen very few, I've heard very few of any kind of side effects at all. Now, doctors that I've worked with that are in Dr. McGrath's kind of coalition, his colleagues, they'd like to prescribe 5 milligrams for men and 2.5 milligrams for women. And that's pretty much baseline. Now, if anybody comes back for any reason and talks about things such as maybe a little inflammation in the lower extremities, that usually happens in a female who may be elderly, could be 75, 80 pounds. We'll knock it down to 1 milligram. We have a lot of females and males that are online and they see scary stuff about possible side effects of anything, finasteride, minoxidil. We take that very seriously. If it's a placebo issue, it could be just as hurtful or impactful as an actual side effect. So we have to take care of them, listen to them, and knock that dose down a little bit, maybe take it every other day. So if there's a will, there's a way. If you want to keep your hair, and that's what this is all about, and this is really what I've been all about online on YouTube and helping people, is how to keep the hair from falling out. That's something that was very challenging for me. It's easier to keep what you have than get back what you lost. So the oral minoxidil, once again, is a great asset. I have seen very, very few to zero side effects. A lot of it has to do with reading about things online, mainly revolving around heart issues or blood pressure. And normally this doesn't happen, and I'm talking a high 90%, meaning 98, 99% of patients that I engage with. And again, should you have an issue, an actual issue, and you get nervous or scared, just immediately stop the medication. Call your physician who's prescribing the medication. Most likely, if you're okay with moving forward with about half the dose, you can go all the way down to 1 milligram, because anything is better than nothing. I would not say anything here to scare you or to try to put you in any kind of fear. The actual objective side of this, which is what I'm a big fan of for everything, is that it's a hypertensive medication, oral, dose to males or females up around 20 to 25 milligrams. Now, I happen to have some little bit of hypertension. I'm doing much better since I lost like 18 pounds. And that was actually a lot of muscle too, unfortunately, but my heart didn't like the few extra pounds that I was carrying my whole life. And I've now brought my blood pressure down. I don't credit that to the 5 milligrams of minoxidil that I'm using, but if you're someone that's very sensitive to medications, like me, or you're someone that just gets it in their head from a placebo standpoint and is scared of it, you need to take your time. We're in this for the long haul. We want to keep our hair for a long time, and I don't want to scare you away from this medication. So I would tell you, with you asked me to come on your channel, and I appreciate that, Bobby, that for those that want to know more information about it, consult their doctors, their physicians. But I would tell you that if you want my opinion, it's very safe. If you're a little scared, like my good-looking young friend here, then you definitely start at a lower dose. It could even be 1 milligram and work your way up.
For sure, because that's what I was thinking too, because I already kind of microdose the finasteride as it is by cutting it in half and taking it every day. So that could be something I could do, just be, hey, just maybe taking a little piece of the oral and just see how that goes, and if it's okay, then build up from there.
Yeah, I mean, I call it a cocktail, just to keep it light, and we're all our own person, whatever we feel comfortable with. But what I will tell you is make sure you document everything to make it easier on yourself to kind of track, and make sure you document everything with timestamp photos. That way you know whether this is working or it's not. I think one of the biggest disservices we do ourselves, I'm included, is if something goes wrong with our life, or something happens, or we get a cold, or anything, it's, oh my God, it can't be, me. I am in great shape. It's got to be the medicine I'm taking. And that happens a lot in the whole erectile issue conversation with finasteride. Can't be me. I'm Superman in the bedroom, right? I'm actually not. It's got to be the pill. So don't put that pressure on yourself, okay? Try it, see if you like it. But I will say this, that you need to talk to your doctor to make sure he's cool with you using it.
Oh, for sure. Yes. And if anybody else, the same thing, just always consult with your doctor. I always do. And then, do what's best for you and save your hair. So, and until next time, guys, as always, like and subscribe to my channel. I really appreciate it, and stay tuned.